the next talk, and we're waiting to hear Dr. Frank Larkin talk to us on decision-making editorial handling of research at the British Journal of Ophthalmology. Over to you, Dr. Larkin.
I'm very pleased to speak at this session, as I did 2 years ago, I think in Kuala Lumpur, and there was a tremendous session on journal publication. My journal is, as I said a few minutes ago, published by British Medical Journal. We've got the reason I've come to India in particular is that we get lots and lots of submissions from Indian authors. These are just statistics from my own journal. And we have a low acceptance rate of articles from Indian authors. And I think I really would like to do something about this. Some of it is changeable, is achievable, and some may not be. These, just for the interest of those of you working here in India, these are the institutions in India that have published in the British Journal of Ophthalmology 2020 to 2024, led by the LV Prasad Eye Institute, and you can read the names of the other distinguished institutions there. So these are very fine institutions, and we've seen some tremendous work coming from authors in these institutions. We have quite a wide reach, best of all in the United States, not surprisingly, but India is number 2 in page views for our journal in the world, reflecting its great size and also its great interest in international ophthalmology. Now, this really is what I think you've been asking me to speak about, is the perspective of the editor and editorial decision makers. And we have really 3 categories of decision making. The first is, of course, screening the manuscripts on arrival on submission. And I've just listed there the questions which I want to address. The big one is, should we review this paper? In other words, should we take that submission to a higher level and get it peer reviewed by those on our editorial board, and more particularly peer reviewers around the world? So the subsidiary questions are in black. Is this work in scope for the journal? That's almost always yes. Is it research? It might seem silly to even ask that question, but some of what's submitted is not research, and that will be immediately rejected at our journal. Important question number 3, does it claim to report sufficiently original, relevant information to warrant the more detailed reviewer assessment? And finally, relevant policies. What that means is the essential policy, the relevant policy fulfilled. For example, in a clinical trial, has there been a consort diagram completed and submitted with the manuscript, and similar additional diagrams of that kind? So that's screening, and should we review this? Now, moving on to the next, authors need to know that reviewers advise, but they don't decide. I will sometimes get reviews back from distinguished reviewers who will have made decisions, often unanimously. Sometimes one says accept, one says reject, and as an editor and as a section editor on our editorial board, we've got to make a decision. So we will not always go with the peer review consensus. But the key questions you will see there are methods, originality, relevance, and are there any what we call fatal flaws? Is there any single limitation in that published paper which means it is unacceptable and must be rejected? As editor, I want to know, because I'm a corneal and external diseases specialist, I know very little about cutting-edge retina, glaucoma, neuro-ophthalmology, etc. So I need to know, is it novel from experts in that field? I need to know, is there bias or is there a significant risk of bias? And most importantly, what I want to know from reviewers and from section editors is, will this change clinical practice? Because those are the papers that every journal editor wants to attract and wants to publish. You can put it another way. I like this, RIOT, R-I-O-T, relevant, important, original, and trustworthy. And one of the things that you see as an editor, and you have to make a decision, is a manuscript coming in which is not really at the beginning of a new body of research and a new body of work, and is largely confirmatory of earlier published work. And on those manuscripts, you've got to choose carefully. And of course, what we all really do want is to publish work which is at the forefront and ideally at the beginning of a new area, moving point in ophthalmology. Now, I won't go through this big long list in detail, but these are the questions that as an editor, I want answered by reviewers, and my section editors will want this answered by reviewers. And that is a more detailed version of the slide I showed you just a moment ago. Now, the second decision-focused question is following review. What are the modifiable weaknesses, and does the journal want to publish this work? So this is a kind of an assessment of the strengths and limitations that have been identified by peer reviewers. I want to know, is enhanced scrutiny needed? For example, do we need to get professional statistician assessment of the statistics in a paper? This is really important for us in big trials. It's less important for us in less comprehensive statistical analyses. The editor's view, the section editor's view, and my own view, what would the authors need to do for us to publish it? So it's come back with reviews, and we need to decide in the communication to the authors what they've got to do. We'll pass on the reviewer comments. We might add additional comments. For example, more emphasis please on limitations of the paper, things of this kind. So that's the second kind of category of questions. And this is the third. When the paper comes back following revision. And the question here for us is, can we accept this? Have the critical issues identified at peer review been identified? Is it possible for them to be identified? And sometimes it's not. Have the basic standards been met? That obviously is a key. That question must be addressed. Is further enhanced scrutiny needed? Do we need to get further statistical advice? Is there disagreement on which we need to get expert further advice? Perhaps a third review where we have 2 peer reviews. Can the transparency in communication be improved and used further? So that in brief is the decision focus at the editor level that we use in the journal. Screening, review, and the assessment of the revisions. Just before I finish, I just want to flag this up. India is a wonderful country producing wonderful research on eye infection. I think it's the finest area of research that I know of taking place in India, and we're in our own journal particularly interested in this, and we're publishing a special topic edition in early 2026, which I hope will feature much work from the excellent Indian researchers that are active in this field. And thank you for your kind attention.
Thank you so much, Dr. Larkin. I think it was a very beautiful sum up of the way you deal with the articles. I have a question for you. How do you decide about commentary for a particular article, and is it always invited, or?
Commentaries are, we'll usually commission commentaries, first of all, if at an editor level we think work is important and we want to highlight it. The second reason why we will commission commentaries is if the reviewer or reviewers suggest this. And sometimes you can read the reviews as an editor, and you can see that they're really interested in the work, and they're pointing to importance and this kind of. So at that stage, quite often I will approach one of the reviewers or the section editor and say, would you please consider doing a commentary? But it's very subjective. Yeah.
I have a question. You showed that the response rate from India is very poor with regard to acceptance in the BJO. So any particular reason that you have, tried to find out why compared to China or many other countries where is it the language, or is it just the concepts that are coming from India which are not really suitable for
It's
the
a
German?
mixture of things. It's not so much language, I would say. I think it's quality. I think it's standards. I think trial design is improved all over the world. And maybe India is not, I'm being very general here, maybe India is not right up there in terms of that area. I think, but largely quality rather than and that may also reflect a responsibility of senior authors, really, to polish the work better and to before submission. I suspect that's one of the reasons. Yeah.
Maybe I can just add on to that. I think India is also now probably improving its standards of Indian Journal of Ophthalmology, and our authors do find publishing with the IGO is probably easier for them, because I know a lot of authors from India cannot write to the editorial board or the chief editor directly if their article faces concerns. But I have a lot of queries coming into my inboxes directly, both my emails and my personal social media, querying me about why their articles are not being moved further. So I also probably feel that the acceptance for Indian authors to choose Indian Journal of Ophthalmology as their primary submitting podium or the portal is probably on the increase as well. But yes, I think I've published my keratomalacia and keratoplasty in keratomalacia in British Journal of Ophthalmology when I was a resident under Professor Radhika Tandon, and it gave me immense thrill to have a paper in the BJO, and that still holds good for many of us here.
Very nice talk on decision making, which is something which really we all of us do daily. So partly I think you've answered what I'm going to ask, but it's still something which bothers us. So sometimes you have an article which goes against a little conventional thought. It may not be perfect, but it has some relevance. You send it to two good reviewers, you think they are the good reviewers, and one of them gives very good comments and the other one totally gives opposite comments. So then how do you go about it?
Well, that's really interesting. But as an editor, you've got to have broad shoulders. I always say that. You've got to be prepared to take a chance. You've got to back people when you think they're worth backing. It's like life. You can get a third review, but I think when you get very, very opposite opinions, and they're from people with sufficient experience in the field and sufficient importance, it does happen, and it happens quite regularly. But it's very interesting. I like those decisions. I find it interesting. And I'll often go back directly to the reviewer and say, look, your view that you've given us, for which we're extremely grateful, is diametrically opposite to another peer reviewer. And it's quite interesting. You've got to make it a judgment. And look, we get it wrong sometimes. But I think what journals, one of their most important functions, is to generate discussion. You can't just close things down because there isn't unanimity on the superb quality. And much wonderful research has arisen from voices that are not, consensus, and we've got to encourage that. But being an editor, you've got to have a bit of courage, I think, and I've been doing it for 4 years now. Dr. Parrish, I don't know how long you've been doing it, but it's
yeah,
you learn.
I agree with Dr. Larkin very much. We encourage what is called post-publication peer review. It's a little different in the AJO. I have a group of about 40 editorial board members, all, I think, world-class experts in their area. If I sent, or in the old days, would send a submission to Dr. Harry Flynn from my own institution, who was a world-class expert in endophthalmitis, and if he looked at it, he didn't need 3 people to tell him that it wasn't worth a review. So I've come to trust enormously on the editorial board members, who will then, in turn, if they think it's worthy, send it out to 2 or 3, and then it comes back. At the end of the day, if it's published, there still may be controversy, as Dr. Larkin mentioned, and at this point we encourage correspondence. That's not a letter to the editor, but really a correspondence with specific questions about a published article. There was a time when we would publish any of those, but it turns out some people were using that opportunity to beef up their CV. Unbelievably, it never occurred to me. So now when a correspondence comes back on a published article, I will send it back to the editorial board member, ask them to peer review the correspondence. If they said, yes, this is an important point, the authors should address this, then I then send a letter to the authors of the original publication who will respond. If the correspondence reads, no, they're just trying to promote their own idea and they almost didn't consider what was written in the publication, it would be rejected. But I agree, post-publication peer review is one of the strengths, and it's frankly very difficult to generate correspondence from my standpoint.
I think, yes, Dr. Parrish, I agree with you that there is a trend to use letter to editors and correspondence for more of personal benefits rather than really looking at it as a post-publication peer review process, or probably adding on to what the article is already telling the audience about it. And yes, we also follow the similar policy of getting those peer reviewed again, at least by our associate editors and by our reviewers before we do consider all the letter to editors, and we do have quite a significant number of them, and the rejections on them do tend to be much higher as well with us as well. Yeah. Yes. Anything else?
Yeah, another challenge we're facing in India now is that the Medical Council of India, the National Medical Commission, has mandated that every person who's in teaching in a medical college has to have a certain number of peer-reviewed indexed publications, which the numbers are so huge, plus we have every person who's doing MD ophthalmology or MS ophthalmology does a thesis as part, and there again is a large number of people. So maybe that's another challenge that we're facing. So from that point of view, the Indian Journal of Ophthalmology has given one kind of a platform, but maybe we could consider having a journal such as Postgraduate Ophthalmology, which could be a supplement. I don't know how technically easy it is. So it's understood that it doesn't have maybe the same element of, say, novelty, but it could be a different angle of looking at a disease from the local perspective. So something to encourage this postgraduate ophthalmology so that they have a platform where they can publish their thesis, obviously not compromising the principles of publication, but recognizing that after all this work has been gone through the ethics committee, and that information should be available for somebody else to look at if they are planning a study further on. So even maybe just a listing of the thesis somewhere, or with this is the main conclusion, so some kind of a supplement or some kind of a appendix. Maybe you will not be able to do it, but maybe Indian Journal of Ophthalmology, because it's a local issue. I don't think any other country mandates this kind of a requirement of its academic professionals.
May be wrong, and if there's anybody here from China, I stand corrected, but as far as I know, in China, a similar instruction has been handed down, and there is pressure on young Chinese researchers to have a certain one or two published papers, and the Chinese Journal of Ophthalmology, I don't think that's the correct name, but they are publishing an English language translation of their own journal, and they've approached the British Medical Journal about cooperating. But I think the institutional pressure from the Indian Medical Council, that's very interesting. I think it's a very good idea. But I think international ophthalmology journals, which base ourselves on research, so the Indian Journal, the American Journal, the British Journal, and equivalent journals elsewhere, we will probably want to stay above that level, exactly as you say. But I think it's a very good instruction and a very good initiative.